Dear audience, welcome. The title of my PhD thesis is Diabetes mellitus and its effect on oral complications. My name is Bulcsú Bencze. I'm a second-year resident at the Department of Prosthodontics, and I'm a first-year PhD student in the Translational Medicine program. My supervisor is Daniel Vég, and my scientific methodology supervisor is Bianca Gorzio. My vision is to provide adequate dental treatment for medically compromised patients, focusing particularly on prevention and prosthetic rehabilitation. In order to achieve this, I would like to find and provide scientific evidence on the possible correlations between systematic diseases and oral complications. Here you can see a brief overview of my ongoing projects. I have started my first systematic review and meta-analysis on the September of 2022, and my second one on the December of 2022. The title of my first project is Investigating the Effects of Different HbA1c levels on the incidence rate of dental implant complications. As for the background, diabetes mellitus is a worldwide disease with more than 400 million people suffering from it. Not only that, but patients with diabetes tend to lose twice the amount of teeth compared to systematically healthy individuals. 30% of the patients appearing at general dental practices above the age of 30 suffer from dysglycemia. This can be either hyper or hypoglycemia. Patients with chronic hyperglycemia have impaired bone healing, blood circulation, and they have an increase in the formation of glycated end products. These products can interact with the receptors, RAGes, and they release pro-inflammatory cytokines, the likes of interleukin-1 beta and TNF-alpha. Both of these can be found in the periodontal tissue, which means that they increase the periodontal inflammation. This could lead to alveolar bone loss around both natural teeth and both dental implants. This is one of the main reasons for dental implant loss. We can measure a patient's last 2 to 3 months of average blood glucose levels with the help of HbA1c. HbA1c is the glycated end product of hemoglobin. A patient with chronic high blood glucose levels with the presence of dental plaque have an increase in the incidence of both hard and soft tissue inflammation. We can measure both of these clinically with the help of bleeding on probing, pocket depth, and alveolar bone loss. Our aim is to find an HbA1c level to provide safe dental implantation without long-term complications. To answer our clinical question, we have used the PFO format, with the population being patients undergoing dental implantation. The prognostic factor is diabetes mellitus, and our primary outcome is marginal bone loss. We have used several secondary outcomes, for example, pocket depth, bleeding on probing, plaque index, implant survival, and peri-implant circular fluid cytokine levels. Our hypothesis is that higher HbA1c levels are associated with a higher rate of implant complications. I have conducted the systematic search on the 13th of November in the 3 main databases, in Medline, Embase, and Central, and I have found over 2,200 articles. I have used the following search key, which consists of 2 different domains. The first domain is about the population, which is patients with dental implantation, and the second domain is about the prognostic factor, which is hyperglycemia, diabetes mellitus, and HbA1c. Here you can see the flowchart of my selection. From the 2,200 articles, I was left with 1,800 after the application removal. With title and abstract selection, we were left with 54 articles. And from that, we have selected 36 articles to be included in the study via full text selection. Here you can see the Prisma flowchart. And I would like to continue the data extraction, and I would like to finalize it by the start of 2023. In my next topic, I have stayed within the scope of diabetes mellitus and its effect on oral health, with the title of Investigating the Effect of Diabetes mellitus on the Survival Rate of Oral Squamous Cell Carcinoma. As for the background, head and neck cancers are a widely spread malignant disease all across Europe, with Hungary being on the #1 place in terms of incidence rate per 100,000 capita, with more than 23 cases. This translates to 3,000 new cases in every single year. Not only head and neck cancers are very common, but they are dangerous as well. They are the 11th most deadly cancer type in Europe. I have chosen OSCC because it represents up to 90% of all intraoral cancers. And it is a very important topic for dentists as well, because in order to reduce the morbidity and mortality of this disease, prevention and early detection is key, and dentists play a crucial role in it. There is evidence in the literature that patients with diabetes have a higher incidence rate in malignant diseases. This could be either because of hyperinsulinemia, which enables malignant transformation through insulin-like growth factors, or because of hyperglycemia, which helps cancer growth by providing ATP. Our aim is to investigate the association of diabetes mellitus and OSCC in order to help in the prevention and survival of the disease. We have yet again used the PFO format to answer our clinical questions, which the population is patients diagnosed with OSCC. Our prognostic factor is once again diabetes mellitus. Our primary outcome is either disease-specific or overall survival, with secondary outcomes based on clinical pathologic characteristics and hospital stay. Our hypothesis is that the survival rate of OSCC is significantly lower in diabetic patients compared to non-diabetic patients. I have conducted the preliminary research as well with the following search key, which yet again consists of two different domains. The first domain is about OSCC, and the second domain is about diabetes mellitus and hyperglycemia. In the three main databases, I have found over 4,400 articles. As a summary, I would like to say that I would like to submit my first project by the May of 2023, and my second project by the September of 2023. I would kindly thank you for your attention, and I would like to close my presentation with a quote from Friedrich Nietzsche: "Truth tends to reveal its highest wisdom in the guise of simplicity." Thank you.
So first of all, I want to congratulate for the great presentation. And my question would be that, what is the mortality rate of oral cancers in the general population?
Thank you for your question. Oral cancers have around 50% in 5-year overall survival, but I think this data is for the OSCC, and oral cancers should be around the same level as well, because the majority of intraoral cancers are based upon the OSCC cases.
Thank you.
Hi. So I have a question about your second topic, about the primary outcome. You said you wanted to assess the overall survival. So my question would be if you would like to narrow your article selection based on the follow-up period to better assess the overall survival.
Yes, I would really like to narrow it down to studies which only states at least the 5-year survival. So that would be the basis of my study. But since I have only conducted the preliminary research, I don't really know how much studies are available for me, but for sure that would be the final goal.
Thank you for the presentation. My question is about your first project. So, you know, if you remember the FINER acronym for a systematic review, it has to be interesting and it has to be novel. With the premise of your first study, we already know that properly managing diabetes is an interest and it's the goal for everyone. What do you think is going to add to the current knowledge that we have about managing diabetes, and in clinical practice, what will it add to know or to show with a systematic review that, yes, indeed, uncontrolled diabetes will have poorer outcomes? Because this is something we already know. So where is the novelty aspect of this review?
Thank you for a question. Yes, we have guidelines from diabetologists for HbA1c levels, but we have no such guidelines in dental practices, for example. And I would like to, obviously, uncontrolled diabetes is something that should be taken into account, but many patients are discouraged from dental implantation because of their diabetes. And I would like to find out if it is true or not, if uncontrolled diabetes is indeed unadvisable for dental implantation. Because if, for example, patients with poorly controlled diabetes, around 9% or 8%, but they have similar complications compared to systematically healthy individuals, then we could say that, all right, the patients have uncontrolled diabetes, but the dental implantation is still advisable to replace their missing teeth. Only maybe more frequent recall visits are necessary, for example.